Hi everyone, I am with Dr. Kissoon at NWRHA at the St.James Medical Complex, the National Cancer Center for Trinidad and Tobago. And I'm very pleased to be with him because he has played an immense role in helping us design this platform. He's taken a lead right from the beginning, participated in all design sessions, given us invaluable inputs. Without his contributions, the system would not have been possible. So let's get started. Let's get to know a bit more about him.
Okay, well, I've been here at the Northwest Regional Health Authority for almost 6 years. In August will be 6 years, and I've been in oncology for the entire time. I've always been interested in specializing in oncology, so that's how I first came to the Northwest Regional Health Authority and particularly to the National Radiotherapy Center. And in my time here, one of the things I noticed initially when we had a paper-based system was how, I guess you could say, the lack of standardization across notes and all of that. So at first I came up with the idea of doing over a few of the forms for chemotherapy admission, new patient visits, kind of just so that we all capture the same data, whoever the doctor is on the day. And that's, I guess, where it started in terms of my contribution in terms of forms to this institute. And then when you all came and there was talk about electronic records becoming a part of it, I'd already kind of played a role in our existing forms. So Dr. Mike and Dr. Narayan Singh at the time had also said, well, you'd be a good person to come and join in on the meeting so we could kind of give some more input. And I guess from there, you all were very friendly and very open to discussion and kind of visualizing everything from coming in the door to seeing the doctor, getting treatment, leaving, the entire process. And so it was a good starting point. And myself, with my experience here as a junior doctor in the clinic for many years, I think together we just were able to start to work on the design phase of things. And like I said, the team from Newfield was very responsive to all of this, and that kind of helped us to be able to customize the system into something that would be really useful for us on a daily basis, and not just useful, but also efficient. And definitely to make our lives a bit easier.
And that's a key part of a process, understanding the process, how the doctors work, because I think electronic health records get blamed a little bit sometimes for them. I think we absolutely require them. Every doctor I've talked to always says we absolutely need them. We just need to make them friendlier for doctors.
Oh, for sure, because I could see if this system wasn't customized to our clinic, and we had to find a way to take a out-of-the-box system and kind of, customize it to our needs, it would definitely have taken a lot longer. And also what I like about the system as it is now is that it's a clean interface. It's very easy to see what information you're looking at. The actions are, clearly visible for the majority of things. It's a very minimal interface, which I prefer than some of the heavier interfaces that you see in some of these other programs. And of course, it being web based is just could be accessed very easily from anything.
Did you have any experience designing any web systems earlier?
No. I'm purely just a personal interest in terms of technology. I've just been technologically savvy, I guess you could say, for a long time.
Yeah, the first time I met you, I noticed you had all of your Apple devices.
Yeah.
So you enjoy technology,
I actually had an iPhone from back in the day when, the iPhone was the only real smartphone. And then, they started, all the Android and so forth started coming out. And I remember back then, I was just so amazed at what the device could do. And similarly, this whole process has, again, opened my eyes to how useful electronic records can be to optimizing the flow, and not just the flow of your clinic and the ease of having records instantaneously available for multiple doctors to view at the same time, can be viewed at multiple locations and all of these things. But in addition to that, the potential benefits for research for us as physicians, being able to capture all these segments of data much quicker without the tedious need of going through paper files and looking through these things. Those are things that are right now understated because we're now launching, but in a few years' time, we'll be able to see some significant benefits for the whole region.
Yeah, well, we're hoping to have analytics for you within weeks or
I've already
months at
seen
the
some of the
most.
analytics on
Yes,
pharmacy,
the
and
pharmacy
that by
dashboard.
itself is
Yes,
also very interesting
yes.
because we would not have appreciated that
Hmm.
data, would not have been able to appreciate it because you can't see it.
Right.
Until you see it presented to you in that manner,
Yes.
that's when you could really grasp some of the finer details about our operations here.
Because our team, one of the things when you're researching and we're getting into building what we like to call the Universal Health Information Network, and then we said we have to do EHR platforms for hospitals. One of the pain points I saw was, people didn't always have the analytics. It was always, it's like a separate project, not always, but a lot of times. And some of our advisors also mentioned that. So we wanted to provide analytics right from the outset. So that's what we did when we put pharmacy live. Within a couple of weeks, we have the dashboard, and then we've been adding to it as the pharmacy team has asked for more information.
For sure, having analytics at your fingertips, it can directly influence how you manage your resources, how you manage your patients. A simple thing such as before,
right?
If I was to put a patient on a particular chemotherapy drug, I may or may not know about the availability of stock at the point in time. I may later find out that, we didn't have that drug and have to change the regime when they come back a week or two down the road. Or on the same day I'm admitting a patient and then they reach upstairs for chemotherapy and then we find out we don't have the drug. That's been solved because from the get-go, I know the availability of stock because of the system.
We integrated all the departments.
Again, it just shows where you cut out time. And then because of the complexity of our little institution here and where the file goes from one place to another, there have been many instances of files being misplaced or left at a particular location, and so there was just time lost for human error in terms of leaving the file here, or the file could go to the wrong location, and that's all just been gone.
Sure.
Prescriptions don't need to be carried by someone to pharmacy to be filled; they instantaneously reach. And again, there's no loss of this data. We've had instances where the file gets misplaced or the prescription gets lost. You have to rewrite it, and that's just adding to your time and daily frustrations, things that are now, a thing of the past, I think, with the electronic system. And that's just some of the benefits that I see on a day-to-day basis. Plus, having the file electronic in front of you, I don't have to spend as much time writing, because writing, so many times you're writing the same thing over and over again. And because we were able to customize our forms, electronic forms, to suit our clinic needs, it meant that now I'm just really entering the data that changes. So just the act of actually putting in the electronic data is much simpler and faster than I would have done on paper.
Right.
And things like auto-generating prescriptions, again, saves me time. Being able to access all of the previous visits very quickly, it's much faster because we've had in very big files patients who've been here for years. We've had instances where things are out of order and you spend a lot of time trying to make sense of it.
Yes.
And so one of the key things we discussed was the summary of the patient. And that's been so helpful that at a glance on the electronic record, you're able to click and there you have a snapshot of the patient waiting for you.
I think summaries have been very effective.
Yeah.
And thanks for helping us design those summaries to be that effective.
I mean, I was just very happy to help, and I'm very happy that you all gave me the opportunity to kind of work with you all to create something that would be very helpful to everyone here.
Now, tell me something. You'd used electronic health records before this, right? In other places, or not really?
No. In Trinidad, not in Trinidad. I've seen it before.
You've seen it before.
I've seen it abroad, but to say that I've had interactions with it, not really.
Because you took to it really well, right? So one of the anecdotes I want to share, right? So Dr. Kissoon, so we walked in, we saw him with his MacBook and everything, and he got working with us, and he got us all the forms which he designed. And then when we put it together, right? So and we started doing a review session. The first time we showed the platform, it was amazing because the room was full of a couple of doctors and lots of nurses.
Yeah.
And Dr. Kissoon pretty much took over the system from me, and he knew it better than I did. Because it designed the way he provided the inputs, and that was amazing because I'm not a cancer doctor, right? I'm a software engineer, and I put dummy data in, so he made the whole session real.
So the thing is that, again, because you all had customized the system in a way that we had asked of you all, it was almost immediately recognizable to myself, who was there throughout.
Right.
And for anybody who's coming in, I mean, it was fairly simple. And I mean, one example was that we had a training session just before launch, and one of the doctors who had never seen the system and never had any hands-on time with the system was able to admit a patient, create a chemotherapy regime, do the prescription, sign off on everything in under 8 minutes.
That's
And
amazing.
we couldn't find a
Yes.
drug, and that probably took like a minute and a
Right,
half.
right.
So you can imagine that probably would have taken less than 7 minutes at its
Yes.
very first try.
Yes.
So when you think about that, it just goes to show that's probably equivalent to what we would take now if we were doing it on paper, and probably even faster still.
Okay. And that's the very first time.
That's the very first
Yes.
time. So you could imagine, and it was a lot less work, and that would be there on the system, you know, had it been a real patient. That would be there accessible every time going forward, and he's only going to get faster with the system until a point. But it just goes to show how easy it is to use.
Right.
And I have to say that you all have been very, very hands-on in the launch. And so whatever little issues we've had, little things that we've seen, yes, this could be improved. You know, maybe this could flow better. Having you all here with us and there to kind of make these little changes, make notes of these changes, and get that onto the platform has also been really good.
Yeah.
For us as a clinicians who
that's
have to
good
use
to
it
hear,
daily.
because that's very much part of our software engineering process, and that's something which I do like to talk about as software engineer. With electronic medical record platforms, if you put some effort in working with the doctors and the medical staff and do some tailoring of the system up front, it saves you time forever, because it reduces time on training every single time.
It's true.
Whereas if it's not intuitive and you have and the medical staff has to learn a new process, you know what? Every time you get a new staff member, they have to be trained again.
Yeah.
Whereas so if you do some tailoring up front, saves you time forever in the use of the system.
And generally, there is always some resistance to change.
Right.
And when people see something that they have never seen before, if it's very heavy, if it's not customized, if it doesn't seem at least somewhat familiar to them, it's daunting at first.
Right.
And so this system, because of how simple and clean cut it was in terms of just the user interface, was very minimalist, which I think helped particularly some of the other staff who may not have had any kind of significant access to anything like this in terms of an electronic record system. It helped them to say, okay, this is fairly simple, like how we tailored the nurse's toolbar to have things that they would use more frequently versus the physician toolbar, which will have more things. I mean, that by itself would help the nurses to kind of focus in on what they would have to do, and it's more clear for them than if it was to be too cluttered and you're trying to find just the things that you need out of this whole list of things that the system could do for you. Now, the system that's built can do all of these things, but you don't want it all thrown at you.
Yes.
And then you're trying to
you have to be able to go through the system and intuitively find it.
Yes. It's less intuitive. So, like I said, customizing it up front is definitely the more intuitive approach and the more efficient approach in the long term.
Right. But so we met for the first time in January, right?
Yes,
I think second week of January. And then in May, on May 1, we had Pharmacy live, and now it's July, and we have the whole platform live. How does it feel? Because you've been very much part of the team. How does it feel?
If I had been told
in
any time in 2018, even December 2018, that come July 2019, we would have electronic records at St. James, fully electronic records, not just partial, actually complete system up and running in July in St. James, I would have said, I really would not have believed it. I think the time scale to implementation from the start of the design process, to me, was pretty astounding. We are live now. It's today's the second day of usage. And of course, when you're implementing any new system, staff has to get accustomed, and training is never enough. It's not, as soon as you get hands-on, you get to do it 3, 4, 5 times in succession, it's going to become natural. Kind of like what we say, motor memory, So a lot of the staff is now kind of, getting optimized in terms of knowing how to do things, where to find certain stuff. And I must say, even a lot of the nurses and stuff, they said, you know what? You were right, Dr. Kissoon, really isn't bad. There were some fears about how they would acclimatize to it, how the changes would affect the clinic. And yes, we are a little bit slower on the first few days because everyone's just getting accustomed to things. But the general consensus has by far been that, yes, this is definitely easier. And we can see how this will only get better with time.
Yeah, because it's just even though we put it live for us, and that's another key principle that we follow in software engineering or our approach to software engineering. It's just begun. The journey's begun.
Yeah.
So it's been quite a journey so far, but that's why we're observing the nurses, observing you, taking inputs, and the idea is to incrementally keep improving the system.
I mean,
and keep that teamwork going.
It's less than 48 hours of our clinic being live, and we've already implemented some changes to the system. Small changes, but again, all about just making it more intuitive.
Right.
And like I said, I've been fairly impressed. I mean, I've been there throughout the design process, so I've seen it a lot more than other doctors. But compared to what everyone else is saying, the majority of the doctors, they've all been saying the same thing, which is that we can definitely see how this is going to make our lives easier going forward. I mean, it's just a matter of the first few weeks of everyone getting accustomed, understanding where things are.
Of course.
And I think after 1 week, the majority of staff here will feel very much at home with the system. I think I feel at home with it, and I've had 2 days. I know where everything is now, but I've been involved a lot longer.
Yes.
But there's a lot of other doctors who are using it now for the same time period, 2 days, and they're, fairly good with the system too.
That's amazing.
So again, that's one of the benefits of having something customized to your clinic, to your flow. It's just a matter of less steps up front, and over time, when you're seeing over 100 plus patients every day, those seconds, that 30 seconds to a minute adds up at the end of the day. And what I really like about the system too is that what I have to enter is minimal. A lot of it is already auto-populated from previous entries, from data I've saved before. So everything is there up front, and then I enter what I need to enter on the day. It allows me more time to interact with the patient because I'm not spending as much time writing down the same things over and over again into each file. So that's kind of been taken out, and that gives me more time to sit and actually interact with the patient. So that is one of the key benefits of the system, is really and truly giving me more time to spend with the patient. So I'm not buried in a note, trying to go through, trying to find something, and at the same time listening to a patient and trying to hear their complaints and see how best to manage. But I actually spend less time doing data entry. A lot of things are auto-populated from previous entries and carried forward, and doing new tasks such as creating a chemotherapy regimen, admitting them for chemo, doing prescriptions become much easier. And all of that, when you add the time benefit up, means that for each individual patient doctor interaction, I actually am able to spend more time with the patient.
That's amazing.
I think that's the end goal of a patient-centered approach.
Absolutely.
Something that we really want to adopt at the end of the UNHIN.
And that's amazing, and it's come from the teamwork, working together, and it's been an absolutely amazing experience for us as well. We've learned so much as we've done this as well. So thank you for spending all the time on the platform, and we are so happy it's live and you're using it.
I'm very happy for it to be live too. I think it's been a great success to us here. And I think in the public institutes here in Trinidad and Tobago, this is definitely a first.
Great.
And I think so far it's been a success. And I hope that it continues to be a great success, which could hopefully pave the way for further upgrades in the healthcare institutes in Trinidad and Tobago.
We very much look forward to that. Thank you so much.
Thank you very much.